Hi, I'm Shelly Engfer-Triebenbach, ALK-positive lung cancer patient and advocate.
Hi, I'm Dr. Alice Shaw. I'm a medical oncologist and director of Thoracic Oncology at Massachusetts General Hospital.
Continuing our discussion on ALK-positive lung cancer treatment for patients, let's dive into what happens after you go through 1, 2, maybe even 3 TKIs. What's out there for us?
Well, there are a lot of options still. As I mentioned earlier, there are a lot of different ALK-targeted therapies, which is really great news. But I think it really helps us as physicians to understand what could be driving resistance. And so whenever I meet with my patients, if we're seeing now the beginnings of clinical relapse, meaning some growth of some of the spots of cancer, oftentimes I will have a discussion about re-biopsying a site of resistance so that we can try and do molecular profiling and determine what could be driving resistance.
So this re-biopsy you talk about, I'm hearing a lot about liquid biopsies. Is that inclusive of that, or is it a standard biopsy?
Yeah, so I think I take it on a case-by-case basis. And I think if a patient has an easily accessible lesion, for example, a lymph node that could be easily biopsied, a spot in the liver that could be easily biopsied, we often prefer to go after the tissue itself. However, sometimes a patient prefers not to do a biopsy, or sometimes the biopsy is just not safe to do, in which case we are using more and more of these liquid biopsies. That refers to sampling the blood and looking actually for circulating tumor DNA, ctDNA, and that refers to DNA from the cancer itself that's shed into the bloodstream. And then we can detect that using a highly sensitive assay and sequence a number of different genes, including ALK, to look for genetic resistance mechanisms. And that often can be very revealing in terms of telling us what's causing resistance in our patients.
That technology sounds amazing. Well, thanks again for sharing this information with us today, and thanks for joining us with Hope with Answers.